Thank you, Vivek. Let me just share my slides and we'll then start. I hope the slides are visible. Vivek, are the slides visible?
Yeah, slides are visible.
Okay. We'll start. So, thank you, Vivek, for this opportunity. And I think we have Amit is there from Policy Bazaar. We have Mr. James from NATCO. Dr. Ankita is here.
Yeah, hi, Dr. Vijay. I'm here.
Hi. We have Mr. Suresh here. He's the CEO from Cytical Hospital. Okay. We have Dr. Bharat Bhosale, who is a senior oncologist and the director of Sunrise Oncology Centers. Dr. Bharat, you are here? Yeah,
Hi.
Dr. Bharat is also
Yes,
here.
I'm here.
Okay. And do we have Dr. Venkataramanan, who's the CEO of Kalkinos Healthcare?
Yeah, I'm here, Vijay.
Yeah, okay, great. So let's start, and without any wasting time, we can. My first question is actually deals with cancer insurance issues, and there's only a single clinician among us, Dr. Bharat Bhosale, and I would like to have from his opinion. He works in different setups. He is a consultant in Bombay Hospital, Jaslow Hospital, Bridge Candy, has his own healthcare chain of daycares, and also has worked in Tata previously. So Bharat, what do you think are the issues with insurance today?
Yes, so Dr. Vijay, see, cancer news for a patient as well as the family is anyways, devastating and painful news. And what after a series of counseling, what we start is the treatment. Now there are various aspects. If I can elaborate, it will take too much of time. So I will come to that with point by point. The first thing is, once we start the investigations, you don't have the final diagnosis, you have provisional diagnosis. So that comes under investigation. And that is where the biggest hurdle starts. Insurance companies, most of the insurance companies, I would say, not all, there are companies who don't create this hassle. The investigations are never ever approved by the companies, most of the companies, I would say. What happens, you understand nowadays, there are therapies which you don't need the admission. And then there is a clause where patient has to be admitted, and 30 days before and 30 days after that, you can reimburse. But nowadays, our treatment has so much advances. We do the biopsy, and sometimes it comes as a ERPR positive breast cancer metastatic, and you have two drugs which are being given orally. The patient doesn't require admission at all. No, and there are many other cancers like lung cancer where you do a biopsy, the report comes as a ALK positive. These kind of therapies are point blank rejected. And you also understand the cost is not simple cost. Now, somebody who is paying continuously EMI or whatever, monthly or yearly sum ups for many years, and suddenly the company is giving rejections to a patient who and his family who they are in pain. They are in pain of this breaking bad news. So this is the biggest problem. Second thing, these oral drugs, as you mentioned, reimbursement of oral drugs, as we are not admitting, these are because of the newer innovations. And something which is better than the previous therapy, we have to adapt to the newer therapies. Now, what has happened, Vijay, most of the guidelines, including the NCCN, European, and now we have ICMR guidelines also, they have adapted themselves. These therapies are approved therapies. These are not something which we are giving in a clinical trial. These are approved therapies. Then you write these therapies, these are getting rejected. So the reason behind this, somebody of the age of 70 who has been paying the money for last 30 years, the word chemotherapy has been mentioned in their records. Now you have to understand, chemotherapy is something which is not written for each and every cancer. So the simple rejection comes that your treatment is the reimbursement will be approved only if you get chemotherapy, otherwise it will not be provided. So the thing is that these are all anti-cancer therapy, be it chemotherapy, be it oral targeted therapy, be it a biological therapy which is in the form of monoclonal antibody. Technically I can't label that as a chemotherapy. So this is all they play around the technicality. So this is a major hurdle. And I feel no, many times I had to write and speak to the doctors, but there are companies which don't allow no verbal communications, and we keep on no doing all these communications for years. And you have to understand the survival of these patients sometimes no ends earlier than these reimbursements. So one must from the industry take this point, and many I see this kind of conferences where I can put up my words and the patients advocacy group also can put up their words. This is very, very important point, first ask. And thank you for asking this as a first point.
So do you